Dr. Barrett, there's a lot of myths going on around red light right now.
Yeah.
The first one is red light is not supported by science. Is that a myth?
That's clearly a myth. I mean, although it is newer, there's over 7,000 published studies elucidating the benefits of red light. So it's not a myth.
All red light is equal.
Red light, kind of light is good, right? But, you want to kind of focus on the wavelengths that have some evidence behind it, right? 680 nanometers and then near infrared light as well. But the red light and the visible spectrum 680 has been shown to have a lot of benefits. And then you also want to pay attention to the power, right? So if you have like a tiny little LED on your whole body, it's not going to do much of an improvement. So you need a certain dosage threshold of power for the red light, and that's also been shown in some of the studies.
The FDA does not recognize red light as an effective treatment.
I think the FDA is actually, as slow as they are, I think they actually are starting to recognize red light therapy as a treatment option for a lot of things. So I think that's a myth.
Red light therapy can burn your skin or cause sunburns.
So a sunburn is caused by UV light damage. You could get a photosensitivity reaction with a really strong red light and cause some hyperpigmentation if you're prone to that. So, whenever you start out red light, you want to kind of start on the slower side and make sure that you're not overdoing it. But for majority of people, it's really hard to reach that threshold.
Red light therapy works through clothing.
Red light therapy can work through clothing. It's very markedly, drastically reduced, right? So it's like a white linen shirt, you are gonna transmit some red light through there, but for the most part, you're knocking down like 95% of your ability of that red light to work. So it's better to just be with bare skin.